Hey everybody, my name is Dr. Jared A. Leon, and thank you for joining me today. Welcome to my webinar, A Glimpse into Your Child's ADHD Brain. Listen, I've attended a lot of webinars, I've attended a lot of seminars. My goal today is to give you really interesting information, super relevant in the research, really try to take something away from this instantaneously, and I'm going to try to go as fast as I can because I know it's hard to stay attentive when we're working online, okay? So with that, I thank you and let's get started. So why don't we start with who am I? For those of you who I do know, thank you for attending. For those of you I do not know, you know what, let me tell you a little about myself. I have a BS in zoology. I have my Doctor of Chiropractic from Life University. I have my FICPA, which is Pediatric and Perinatal Certification through the International Chiropractic Pediatric Association. I have my CCP, which is a Certified Chiropractic Extremity Practitioner through the Council of Extremity Adjusting. I'm board eligible for my Diploma in Chiropractic Functional Neurology. I'm board eligible for my fellowship in vestibular rehabilitation. In the last 3 years, I've had 3+ years of training in functional neurology and over 500 hours. I'm the author of Functional Living, a book that if you feel like you have not read and you want a copy, just call the office later in my webinar. I'll give you the number. And I'm presently in private practice for 15 years, really serving the community. It's all I am. I'm a father of 2. I'm blessed to have an awesome family. So all I want to do is give this knowledge to help other families. And with that, let's get started. So let's talk about this, right? The ADHD brain. Let's just crack open this myth really of what this is and how we can go forward into helping out children and adults, right? What behaviors characterize children with ADHD? So let's go. So let's look at the medical model first. So the DSM-4 categorized ADHD into 3 types. Let's go. Type 1, primarily inattentive. Type 2, primarily hyperactive. And type 3 is the combined type. It's pretty funny, right? So you're either one, the other, or you're in the middle. Is that real? Is that all of us for adults? I think so. Did you know that the classification for the DSM-4 actually came out for ADHD in 1987? And an ADD was 1980, was the first diagnosis. So prior to that, it's not funny, but no one had a diagnosis of ADD, ADHD. So with that, what is the DSM? They're codes that are classification found in the Diagnostic and Statistical Manual of Mental Disorders. So basically, it has to go through this organization first, and then after it's in this organization, there's a high chance that there's an associated medication that will go with this. And I'm not going to say I'm anti-medication. That's not what I want to talk about today. But the truth is, I think there's another way first. So with that, let's look about this. But what distinguishes the ADHD brain from a neurotypical brain? In other words, what does the normal brain look like? Wouldn't that be interesting before we just classified children and adults with this disorder? Let's go check it out. A growing body of evidence informs us that the symptoms of ADHD are the result of functional disconnection in a specific brain pathway, from the frontal lobe to the striatum, which sits in between, basically in your ears or behind my mouth through there, into the cerebellum, which is in the back of our skull here, okay? So this pathway we're going to talk about a little bit today, but this is real. This is like real stuff. Like if you want to use GPS to get somewhere, you got to make a right, a left, and a right, and you're there. That's the way the brain works. It's all pathways and connections. So this is going to be the frontal striatal cerebellar pathway. I will slow down. But it's very interesting to understand this because this is how we're going to access our children to give them the benefit of what we now know in science. So the ADHD brain, right? More importantly, this pathway is primarily affected on one side of the brain. That's super important. So consider people who have a stroke in their right brain. What do they experience, right? So I know we went from a moment, we're talking about ADHD, and we're still going to, but we want to say what happens if the right brain specifically has a stroke? These are the results that have happened, okay? So you would have the potential increased impulsivity, reduced ability to adapt to errors, inability to control emotional responses, decreased motor inhibition, impaired social skills, deficits of attention, and deterioration of this spatial awareness. So that means I bump into things more specifically. Spatial awareness is where our brain perceives we are in space, right? So is that interesting to say that if you have a stroke in the right brain, these sound awfully similar symptoms as ADHD? Let's look at the link. So let's take a closer look at this critical pathway, which is explicitly implicated in the dysfunctional ADHD brain. Once again, the frontal striatal cerebellar pathway. You can say this a few times with me fast. Go tell workers, coworkers, anyone in your family. It's pretty interesting. There's the actual pathway in this picture. So you can actually screenshot this. You're going to get a copy of my webinar info at the end if you like it, but that's the actual pathway and what it looks like. So let's look at the research, right? Neuropsychological imaging studies indicate that the ADHD is associated with alterations in the prefrontal cortex and its connections to the striatum and the cerebellum. Research in animals in the combination with observations of patients with cortical lesions have been shown that the prefrontal cortex is critical for the regulation of behavior, attention, and affect using representational knowledge. In other words, affect is mood, behaviors, how you feel, what you look like, your emotion, right? So the prefrontal cortex is important for sustaining attention over a delay, inhibiting distraction, and dividing attention. And more posterior cortical areas are essential for the perception and allocation of attentional resources. The prefrontal cortex in the right hemisphere is especially important for behavioral inhibition. Lesions to the prefrontal cortex produce a profile of distractibility, forgetfulness, impulsivity, poor planning, and locomotor hyperactivity. So it sounds like all of us in ways, right? To some extent. A lesion, just so we're clear, doesn't mean you actually have something wrong like an MRI. It's a functional lesion. That's what we're speaking of as a functional neurologist. So it means you're having some kind of interruption between a neuron to neuron or part 1 to part 2 inside the brain cycle of information, and that is what we're calling a functional lesion. An atypical right brain morphology, or the hemisphere itself. So I don't want to say it, but so basically we have a right hemisphere and a left hemisphere. So that's what we're speaking of, the difference between one hemisphere to speak to the other in the relationship of information. So differences in social comprehension based on ADHD status were especially profound in children with atypical right hemisphere morphology. Thus, the diagnosis of ADHD might be associated with an underlying risk in the area of social comprehension, especially for children with atypical right hemisphere morphology. So the right cerebral hemisphere dysfunction, again, cortical right here, okay? The Anacover analysis indicated that ADHD children demonstrate mild to moderate deficits in the perception of affect, mood, behaviors. This results lend tentative support for the notion that the right cerebral hemisphere may play a critical role in ADHD. So the Anacover analysis is just a super high level analysis of how we look at different things in science, okay? So with that being stated, right hemisphere, okay? I know it's a little deep and some of this stuff is going to get a little complicated, but all I want you to understand is the research I have to present first so we can talk about how we fix this stuff thereafter. A specific neurofunctional biomarker of ADHD. So the most consistently reported functional anomaly in children with ADHD in the right inferior prefrontal cortex during inhibitory control appears to be a disorder specific when compared to patients with OCD and may be a specific neurofunctional biomarker of ADHD. So this is from 2010. So how come all this research has been around 2008, 2009, 2010 and we've not heard of any of these things? I scratch my head too and say, how does this happen? It's which led me on this journey to give this information to you guys, because I have a 10 and 12-year-old. So I'm in the game with you. I'm not just, a doctor who doesn't have this. I see this daily. So with that being said, let's continue, and I promise it will get a little bit more fun in a moment. The right frontal striatal dysfunction. So in the right-handed, typically developing individuals, a righty, a mean increase in the relative thickness of the right orbital frontal inferior cortex with the age of 0.011 millimeters per year was balanced against a relative left hemispheric increase in the occipital regions of 0.013 millimeters per year. In ADHD, the posterior component of this evolving asymmetry was intact. So with that being stated, Sorry for that. I was distracted. Haha, ADHD of my own self, right? So in the ADHD, the posterior component of the evolving asymmetry was intact, but the prefrontal component was lost. So in other words, there was a difference between the back and the front. That's interesting. So loss of the prefrontal component of the evolving asymmetry in ADHD is compatible with disruption of the prefrontal cortex in the disorder. The right frontal striatal underactivation. So ADHD and DD, dysmetric disorder, both have elevated levels of neurological subtle signs, spatial working, memory deficits, and right frontal striatal parietal underactivation compared with healthy participants. 2009. So again, what does this mean? It just means that if the right brain is important for all these things we're discussing, and it's not functioning as well as my left brain in your child or myself or all of us, it just means there's a difference. That's all I'm trying to say. That's all it is. So how does a medication know the difference of a right and left side? Does it? Is it possible? Of course not. It's impossible. It works central. So then we might bring down both parts of the brain, right? So I'm not going to get too deep and I don't want to get too far ahead, but how different is that thinking? If we know that the deficit might be on the right for hyperactivity, how does a brain work if we give it a medication to essentially reduce? Just an idea. Let's continue. The disruption within right hemisphere attentional networks. So children with ADHD show the greatest interference effect compared to controls for right-sided target displays under low but not perceptual load. The magnitude of interference for the right-sided targets was also positively correlated with the ADHD symptom levels. The pattern of right-sided interference effects in children with the ADHD suggests disruption within the right hemisphere attentional networks in ADHD. So once again, to break this down, watch how cool this is. So basically what this is saying is that if you have an ADHD aspect and you can't see things to the right at the same level, wouldn't that be interesting if the child's teacher is to the left? So we're going to talk about that in the future. But the left is going to be different in seeing things than to the right. So one way you're going to absolutely see and keep your attention and focus, and the other way you increase the probability, knowing nothing more than losing the focus. So that's interesting. Think of an adult. If the computer is to the left and you're typing all day like this, is that a different viewpoint for your brain than if it was to the right and you're going this way all day? And the answer is yes. That's all I want you to understand. There's a difference. So decreased volume. So a review of the literature reveals that the more thoroughly examined regions of interest in ADHD children were the frontal lobes and the caudate nuclei. The most replicated positive finding was the decreased volume of the right prefrontal regions in 5 studies. The most replicated negative finding was the normal volume of the left prefrontal region. The right caudate nucleate, part of the striatal pathway, was reported to be diminished in almost all of the studies, 4 out of 5, with a sample size equal or greater than 30. So that is pretty profound. That's over 80% in children or people in this study, right? They actually didn't say if it was children, but what I'm going to say is this. That is a difference in the actual blood quality. In other words, you're going to have a decreased volume of blood to one side to the other. That is profound. Think of if your muscle doesn't get enough blood. It's going to get numb, tingling, spastic, painful. That hurts. So imagine the brain not getting that. You're asking to consistently work through this. It's almost like running around on a wheel of impossibility, isn't it? So if we know that we're setting up a stage through research that the ADHD brain is different in volume of blood, we're talking that potential functionality has been different in these pathways. Is this a possibility to say that if we know this, isn't it kind of cool to say that if you put the research together, we can actually make a change? Of course. Let's continue. So the right frontal striatal dysfunction. In ADHD, there is gray matter reduction in the right putnam globus pallidus region. These are parts of the striatum. So once again, the striatal pathway, okay? This may be an anatomical marker for dysfunction in frontal striatal circuits mediating cognitive control. Right putnam lesions have been specifically associated with the ADHD after closed head injuries in children. So This is from 2008. Let's think about this for 1 second and break it down, because these are big words, and to be honest, until I studied neurology, I never understood any of this stuff, just so we're clear. So watch this. If we look at the aspects of ADHD in relation to a head trauma, how many of us, including myself, but all of us really, have been a child at some point and have fallen and hit their head? That's all I'm saying. You've seen it if you're a parent. We've watched our own children, on beyond sports. When I'm talking sports, we're talking just hit your head. Is it possible that hitting your head when you were 3 and, little Johnny had a little cut here and his first time bleeding, he falls off the couch, right? And now little Johnny is now 9 and now he's in school and now he's having little trouble in attention and focus. And then maybe he's now 12 and they diagnose him with ADHD. I'm saying, is it possible that it relates to an injury that was sustained when he was 3 and it was never been corrected the right way? So all I'm doing is giving you opportunities to think, but it's related in the research to this right frontal striatal dysfunction. What about the right prefrontal dysfunction? The severe hyperactivity group exhibited most prefrontal left increased to right blood flow asymmetry. So reversal of functional prefrontal asymmetry in boys with severe motor hyperactivity supports the hypothesis of the right prefrontal cortex in dysfunction as far as ADHD. In normal subjects, the right prefrontal cortex is activated more than left during the response inhibition. So patients with attention deficit hyperactivity disorder have impaired response, inhibition, and altered structural interhemispheric asymmetry. I know that's a mouthful, so what does that mean? Again, so if patients are having, or children are having, one side of the brain functioning or working differently than the other side, all we're trying to show you again, sorry to be repetitive, but their lack of blood flow is in the research, their lack of function is in the research, and then the symptoms are coming out of these deficits. Doesn't it make more sense if you think about it from just a parenting point of view, that why one child, not the other? Why your third kid, not your first 2? You give the same love, you give the same nurture, right? So what is the difference? Could it be something, I would say simple, but it's so not simple. But it's simple in the understanding that this is something not functioning as well as the other side. And research has proven this in every one of these slides. So again, the right frontal striatal cerebellar dysfunction. So again, just showing you different parts of this pathway. Independent of age, the most robust group differences were observed with respect to delay aversion and time reproduction, pointing to persistent dysfunction in the mesolimbic reward circuitry and in the frontal striatal cerebellar timing in subjects with ADHD. 2010, right? So what does this mean? Mesolimbic reward circuitry, that's huge, that's a big word. I'll break it down again. So what that simply means is this. Picture a child you can imagine. Pick any child you know, family, friend, someone who's struggling with this ADHD stuff, right? Even an adult. Do they have this same reward cascade as a child or an adult that did not have it? So I'll explain real quick, right? So we're all motivated based off reward cascades, okay? And that's proven, and that's through a dopamine response. So when that dopamine response occurs, and I won't get into a neuroscience piece right here, but what I'll say is when that occurs, that's okay because that's the way you can reward something. Think of a dog. Every time he hears the food coming out of the can or something, or the bag, or we give our dog raw food, whatever it is, it's instant. He smells it, he hears it, he comes, right? That's a reward cascade. So in other words, it's the same thing for all of us. So imagine working on children trying to improve their function in school when they lose the reward cascade. Hey, I don't really care if I do well. Hey, I don't really care if I do my homework. So they become less agreeable to do the things we need them to do because they lost this crucial piece of the motivation reward. This is huge. And the cerebellar piece we're going to talk to in the next slide, I believe. So let's continue. So decreased blood flow in the frontal striatal cerebellar circuits. So again, blood flow, right? But now we're talking again, another study. So decreased cerebral blood flow in the right lateral prefrontal, right middle temporal cortex with the orbital frontal cortex, and both cerebellar cortices were found in children with ADHD compared to controls of normal. The study confirms the presence of functional defects in the prefrontal cortex and reports new problems in the limbic area, striatum, reward cascade. somatosensory areas in the cerebellum during the resting state of brains with ADHD. So the cerebellum is really important for the ability of the brain to globally look at all of your muscular systems. So it's like the ultimate boss to all of the way the muscles work, okay? So if your cerebellum's not working well, you may not have the same kind of coordination. These children might have been classified, or adults, as clumsy, klutzy. They always bang themselves. They always fall. They always hit themselves on a table or something. I don't mean hit themselves. Hit themselves on a table. They're bunking into something. They're accident prone. That's all we're saying with this. This is what it's saying in the research. So I'm just asking you to correlate your own mind of what it is. And once again, the blood flow reduction we have already spoke of, just another study to prove this. So what about in the left cerebellar dysfunction? So as we found, decreased gray matter volume in the right prefrontal region and the left cerebellar hemisphere in the previous voxel-based morphometry study conducted on an independent ADHD sample. So we tested the hypothesis that these regions should show neurometabolite abnormalities. So in the left hemisphere, ADHD children showed significant decrease in the neurometabolite absolute concentrations. This is the first protein MR spectroscopic study examining the cerebellum, and it provides additional support for the role of the left cerebellum in the ADHD child, or neurobiology. So what does that mean? Let me just explain quickly without a story, right? So all I want you to understand is that this right brain really links up, if you remember when we were kids, right? And that X concept, and the patients who know me, I always talk about this. It controls, it coordinates the same side face, crosses over an opposite body. So in lieu of that, to understand the opposite body, it would make sense that the left cerebellum is in charge of the left body, just as an overseer, as what I said before. So know that the right brain has a direct link to left cerebellum, and vice versa. Okay, with that being stated, let's continue. So the cerebellar dysfunction. Up to 50% of children and adolescents with ADHD exhibit motor abnormalities, including altered balance, as I just stated, right? Imaging studies indicate that these balance deficits could be of cerebellar origin, as ADHD children may show atrophy in these regions of the cerebellum associated with gait and balance control. Atrophy, just so you understand, just means like a smaller piece of brain, right? So it's getting smaller, it's getting atrophied, okay? Like muscle atrophy. One arm is really big, the other one's really small. So imagine that the brain is actually shrinking on these aspects on these studies. During dynamic posturography, ADHD participants showed mild balance problems correlated with children with known lesions in the cerebellum. These findings support the notion that the cerebellar dysfunction may contribute to the postural deficits seen in ADHD children. So again, altered balance, you might be falling, they get dizzy, as I explained in the last slide, I won't repeat myself, but what I will also say, are these children, you tell me, I want you to go home, study your friends and family. Are they having postural defects, defects? Are they have an altered curve? Did they look forward? Do they have a head tilt? Do they have another side head tilt? Do they lean back? Do they lean forward? Do they rock? Do they move? Does their back really get tight or their neck get tight even though they're kids? Do they get tight hamstrings and tight muscles? Just throwing out there. It's interesting, right? So is it all possible? It all relates to the brain. But the more I study brain, everything relates to brain. So I'm just showing you through research that this stuff is all true. So repairing the ADHD brain, finally, right? I've talked enough, I believe, about the science, and I had to get into the research, and I know I brought a lot of words that you may or may not have known, but here is the code now. So I'm going to show you the unlocking the code by using various therapies that activate the frontal striatal cerebellar pathway have been shown to be effective in improving symptoms of ADHD. So I really hope that going forward now, this is going to be the take-home section, right? This is where you can actually take notes beyond what we said. You're going to get a copy of this webinar anyway, but you can take notes on this. I'm going to give you practical step-by-step things that you can do every day to start now. So repairing the ADHD brain. Interactive metronome in the relation with right eye system has been shown to improve auditory processing, working memory, short-term memory, executive processing, processing speed, cognitive resources. I will get in a moment what right eye is, but amazing is a machine that can actually do that. An interactive metronome is something that works really amazing. I have one in the office in different ways, but what it basically means is that it's going to relate a sound with an action. So while you hear the snapping, for instance, you either have to snap to clap with it, or to snap with it. So that's all we're really talking about in the relation to do these things. We're using multimodal systems to integrate the child's brain for the betterment of them. So repairing the brain again, there's something called a neurosensory integrator. It is proven to help with visual reaction time, hand speed accuracy, divided attention. This has been one of the coolest things we have in the practice. It's relatively new. It's been amazing so far. And I challenge you to come to the office, check it out. It's basically a 50-inch iPad that adults, children, all of us get to play with to strengthen brain. So again, the neurosensory motor integrator, or NSI, in this video, so I'm going to load this up. You can't really see it great, but you get an understanding of what it's doing. So in this video, you actually hear and see a module called memory saccade. So what you don't see though is these dots are disappearing. So imagine you have one dot, and then after that it gives you like 5, 10, 20 distractors, and you have to go back to the first dot that disappeared. So remembering the sequences helps with increasing brain function, increasing focus. Touching the words helps with the eye-hand motor control. That's what this is doing. And those subtle sounds relate as well to that aspect of the integration of that interactive metronome. So we can actually add a metronome to that machine, but now I'm getting too deep and I apologize, but the technology is there. I apologize, let's continue. So what is the right eye system? Once again, I'm going to show you this in a moment because I'm sorry for the boring videos, but sometimes there's no better way to look, okay? So a closer look at this cutting edge neurological eye tracking and testing machine. Check this out.
My name is Barbara Barclay. I'm the president of BRAI. BRAI is a health technology company. We're using eye tracking to build a series of tests that are for patient health, visual health, including concussions, including autism. So wherever eye movement is necessary, we're there. We've got 30 different tests. We have reading IQ, sports vision IQ, and brain health IQ. Say one individual has an eye that's maybe slightly out of alignment. That may seem like a small thing, but it can have a huge impact on your ability to learn to read, for example. We collect the data, we process it in the cloud instantly and give you a report. That's our job. That device has an embedded eye tracker. It's portable. It knows exactly where you're looking on the screen with your left eye and your right eye separately. We have 4 different games that train speed, accuracy, peripheral vision, and right with that test alone, I would know whether you should be an MLB player. We have 7 Major League Baseball teams, and they use this to assess all their players, and they use it for scouting. You will not have any trouble by the end of this year going to a doctor of any kind and saying, I'd like an IQ. So it builds the community of doctors that are available who will not miss important things that can't be seen with the naked eye or can't be seen if you don't have the knowledge.
So thank you for that time, and I apologize again for the videos, but the truth is, that's probably the coolest machine I've seen ever in what it does, okay? I will be able to read that scan for you and show you the exact tracking of the eyes, and it compares your child or your adult to the exact age group. It's really interesting. It is a mind-blowing thing. At the end, I'm going to offer you a gift, by the way, so let's continue, okay? So repairing the ADHD brain. So activities that improve the proprioception and that challenge balance systems have also shown benefits. So in other words, what does this mean? If we use balance, if we know the cerebellum is in charge of all this balance structure we spoke of, and there's a problem in balancing, if we know that, imagine what would it be like if we actually force children or adults to increase their balance. Can it work in reverse to build those pathways back to normalcy? A functional change. The incidence of neurobehavioral disorders in children such as autism, ADD, ADHD, and dyslexia have been exploding at an epidemic rate. The statistics are staggering indeed. But what I find most alarming is that despite the incredible rise in children and families suffering from these disorders, the approach to the diagnosis and remediation has changed very little in the past 50 years. 50 years. So again, if you have a 10 and 12-year-olds roughly my age, so look at it this way, if you're 40 and above, how many of your friends and family members were diagnosed with ADD, ADHD when we were children? It's impossible because I told you it's a trick question, right? It's an impossibility because 1980, 1987 is when the diagnosis came out. So did no one have it prior to that? Or was it just something else? Or is it just so much worse now? It's worse now, right? Did you see a bigger problem? We can go into 2 hours about the why of that, but just think. The electronics have changed. The world has changed. Everything is on a Facebook or social media concept. Everything's visually stimulating. Everything is related to I can sit home and not get out of bed and everything can be given to me. I can hit a button, things come to me instead of me going to a store. On and on it goes. There's genetically modified organisms in food 30 years ago that didn't exist. We can go on and on. With that, let's continue. We need to fundamentally change the way we look at these problems, and we need to do it quickly. The fact is, the most of the answers we are seeking are actually already in some of the brilliant brain research that is being done that I presented. However, as I noticed in the most recent article in Time Magazine, May 2006, although there is some great research being done, none of this information is being used to currently treat children. What? None of this research is being used to currently treat children. Time, right? Interesting. What is the use of all this research if we can't use it now to help these children and their families? Malillo, 2006. Functional neurologist. Awesome dude. Interesting, right? Isn't that true? Why have all this info if we can't use it? Why don't we talk about brain lateralization? This is really interesting. I would take a snapshot of this or a screenshot. Let's actually talk about what right brain functions are, okay? So simply the way you look at this, I'm going to go quick on this, but when you look at the functions, just think, if the brain is healthy, each one, this is what right brain does versus left brain. That's all I'm saying. So if there's a problem with right brain, you might have some problems in the things we're about to label. So in nonverbal communication, so right brain nonverbal. Big picture thinking considers consequences, effective actions on others and the environment. Withdrawal behavior. I don't really want to go out and hang out with my friends. I'm totally happy watching TV. Recognizes facial emotions. Did that person look mad? I didn't realize that. Recognizes emotional tone. The tone, the tonality of voice. Attention, impulse control. Well, the attention and impulse control is absolutely everything we've talked about up to this point. Recognizes humor. Likes novel, new experiences. I love to do new things. I hate to do new things. I like to say the same thing all the time. Emotional awareness and expression. More specific to gross motor control, more specific to controlling our stress response related to anxiety and immune control. So before I get into left brain function, isn't that interesting? This is just a different, newer, cutting-edge version of what it used to be, you know, that the right brain was good for, say, science and math, and the left brain was social studies and history and things like that. But the answer is this is the newer approach, so I think this is really important understanding brain function and brain health. Left brain functions. Verbal communication, detail-orientated, self-focused, approach behavior, calculates and analyzes, prefers list facts, numbers to ideas and vision, stimulates shifts in attention, likes routine, sameness, more specific to fine motor control. Simple difference, I like building puzzles with my little fingers, right? Little tiny fine motor than a gross motor, which would be throwing a ball, gross motor. Before I get into that real quick, isn't that interesting? I mean, I don't know if you're so profoundly wowed, but if you think of this and then you add the little tiny descriptions, this can fit every person you know. So, I mean, this is a profound moment. Take a picture of this one. I promise you, it's really interesting to see how brain works because we can use this in therapy, which is coming up. So let's get started in therapy. So what can we do, right? Isn't that the question? That's why you started this module with me, right? If we know the most commonly affected parts of the brain that are currently causing our child's behavioral and learning issues, wouldn't it be valuable to you to unlock the code for improvement? I think so. So what can we do? Here is some secret information to unlocking your child's code to his or her right brain. Since all the research in the very beginning was all about that, I'm going to give you some actions and strategies right now to do some self-homework, some self-repair possibly For you, friends, family, children, let's do it. So the right brain is activated by low frequency light and sound, familiar faces, identifying the identifying the whole, not the parts, the left field of view, senses from the left side of the body except smell from the right nostril, other as opposed to self, they're opposed to here. So they're opposed to here. So in other words, let's give you a quickie. So right brain we know is activated from that past slide. So imagine we cut out different pictures of family members and we utilize that as a strategy before homework to stimulate the right brain for your child. Could that be so simple? Hey, who's this in the picture? That's Uncle Bill, Uncle Fred. That's my Aunt Lissa. Isn't that interesting if we use that? Is that possible to help your child? And the answer is totally, because it's the way the brain works. So we can use gross motor, postural stability exercises, full body coordinated motions, interoception, awareness of body physiology such as breathing, heart rate, hunger. Generally negative emotions, consider behavioral strategies, withdrawal behavior. So once again, a quickie on this. If you know your son Jaden is having an issue, let's focus on breathing. Let's just breathe in, even though they're going to give us a look like, are you serious? So just the awareness of feeling the air go in and out of the lungs will excite that right brain. Just showing you, it's pretty amazing when you think of these tiny little things we can do. Full body coordinated movements could be anything using full body. I'm going to show you in a moment. So figure eights, what is that? Both arms at eye level, hands interlock, thumbs up, and you can do figure eights. Make a giant 8 that is lying on its side, following thumbs with the eyes. 2 ways, with big body movements, keeping head and eyes basically still, or keeping body still using small shoulder blade movements and moving only the eyes. At home activities, you can do left preferencing. Preference activities of everyday life to the left side of the body in space. Television, music, back scratches, games of catch, books. What about having the teacher to the left? Wouldn't that be awesome? Could that be it enough? Could that alone help your child? And the answer is of course. It's of course. I know it sounds crazy, but it's the way the brain works. And if you just understand that things over here are going to be over there on the left side, wouldn't that be interesting? It's called left preferencing or biasing. Spinning in the chair slowly. I should have wrote that down. Very slowly to the left. Hand clapping games, as we discussed before. Just clap your hands. Left face tapping, brushing, joint compression, distraction. Grab bag, so we can actually, meaning you, can put 10 familiar household items into a cloth bag. Reach into the bag with the left hand and ask to feel and identify the items. Or find a particular item. So find the brush in the bag and don't come out until you get it. So what can I do, right? What could you now do with all of these recommended home therapy activities? Try them for a week, weeks. And look for any changes in moods and behaviors. If so, great, and continue it. If not, have your child evaluated by a chiropractic functional neurologist. Because I'm going to get into this in just the closing, but what I'm going to say is this. Everything I said in those concepts relate to that right brain, to the frontal, right striatal, cerebellar pathway that we spoke of with all that research. So we're going off research. So I'm asking you to try it and see if you get some actual change. Better than anything else, at least we're hitting that exact area that has deficits of decreased blood flow and all the other things we said in research. But the answer is, if you don't see the change, then it's a wrong target, okay? So that's where you need to go and actually get the eval. But here you go. So what is a chiropractic functional neurologist? That's always the question I handle every day. But typically a chiropractic neurologist serves in the same consulting matter as a medical neurologist. The difference is that the therapies or applications of a chiropractic neurologist do not include drugs or surgery. Chiropractic has been traditionally viewed as a musculoskeletal therapy. Research has continued to suggest that the effects of chiropractic adjustments and other manual therapies have direct impacts on the central nervous system, including the brain. The foundation of chiropractic neurology revolves around the understanding and clinical application of how a chiropractic adjustment and other stimulatory inputs may impact the nervous system to help improve a patient's life and well-being. So what is the next step? Go to a chiropractic functional neurologist in your area to get a neurological exam. If you're local, come into my office for a neurological exam, followed by a report of findings where I will go over all your results with you and your family and create a customized treatment plan to start you on your wellness journey. Again, what we stated before was almost customized, but you can't really customize until we know where the true deficit is. We were going based off research, but when you go to a functional neurologist, it'll not only be based off the research we stated as like the first look into, but we're going to verify those findings with a whole bunch of biomarkers in the exam. So again, what's the next step? If you are interested in trying a new path, are you sick and tired of the same old results? Are you frustrated with your child's behavior? Are you tired of the long hours of homework? Does wine become something that you add as your study aid while your child's doing homework for 2 hours? If so, set up an appointment today. My number is 631-689-1000. Want a special gift? We all do. I know how busy life is, and I know how important your time is. So if you call and mention this webinar, I will offer you, your child, any family member a free right eye reading test with printed take-home results. You saw the amazing power of right eye. I will show you and explain to you and answer any of your questions. And you'll leave with a take-home report that literally diagnoses and analyzes everything you need as far as how the eyes are functioning. Call the office, 631-689-1000 once again. So I thank you for attending this webinar. Once again, it's been a pleasure. My name is Dr. Jared Leon, leonchiropractic.com. Honor us and follow us at Facebook and Instagram. Please share this with your friends if you find this at all valuable, which I think, and you would almost be literally in a box if you didn't think this was valuable information. Have a wonderful night. Once again, this is high-level science. I try to make it as fun as I can. For all of you who know me, this is as serious as I've ever been, because it's very complicated. But what I want to say is thank you. Have a good night. Once again, Dr. Jared, 631-689-1000. Thank you, and be well.